Hi, my name is Kelsey. I'm going to be your nurse practitioner today. I'm just going to go ahead and run through a quick neuro assessment on you. Could you go ahead and tell me your name and date of birth?
Breck Rubel, 9/21/91.
Great. Can you tell me the month and the year right now?
It is October 4th, 2019.
And can you tell me where you're at right now?
I'm at the doctor's office.
Great. And do you know why you're here today?
Just for my routine physical checkup.
All right, great. Now I'm going to run through the cranial nerves with you. We're going to go ahead and skip the first one because he hasn't had any complaints with difficulty smelling or anything like that. And for the second, the optic nerve, we went ahead and before we sat down for the exam, he ran through the Stalin chart with the nurse. He scored a 20 out of 20 vision in both eyes, which is a great score. And then I'll go ahead and just check his pupils really quick. Sorry, you're going to see a bright light here. Both pupils were equal and reactive, which is a normal finding. And then I'll go ahead and go through the motor function of your eyes. Just go ahead and follow my finger. Great. Keep following. Great. He had great movement of his eyes, extraocular movements and everything. He followed my finger to the middle, so we were testing for accommodation there, which was good. And now I also forgot to test for confrontation with this optic nerve. So if you go ahead and close this eye right here, I'm going to point my finger over here, and I want you to let me know if you can see it, okay?
Yes.
Okay. And then go ahead and close the other one.
Yes.
Okay, great. So he also has a good score with confrontation, which is a normal finding. And then we'll go ahead and move into sensation on his face. So what I'm going to do here is, I'm going to give you an example. This is the sharp feeling, and this is soft. Can you tell a difference between those?
Yes.
Okay, great. Can you close your eyes for me? What does that feel like?
That's soft. That is sharp.
Okay.
That is sharp. That's soft. That is sharp.
Great. So he has good sensation all over his face. You go ahead and clench your teeth for me. He has strong tone in his face too, which is a normal finding. And then I'll go ahead. He is an awake and alert person with good pupil responses and everything, so I'd assume he'd have a good corneal, but just a little wisp over here. And over here, his corneal reflexes are intact in both eyes, which is normal. And then I'll go ahead and just have you, can you wrinkle your forehead for me? Raise your eyebrows. Puff out your cheeks. Smile real big. Great, so he has no dysymmetry anywhere. He's able to have normal movements of his face, no palsy anywhere. Those are all normal findings. I would usually go ahead and test for taste on a patient, or if they were having like complaints again of taste. Not going to go ahead and do that today, but I could go ahead and test the different sides of his tongue to see if he was having any problems with taste. And then I'm going to go ahead and test his 8th cranial nerve here of hearing. I'm going to whisper 3 things into your ear. If you could go ahead and just repeat them back to me. Go ahead and cover your right ear for me.
Blue, red, white.
Okay, that's perfect. Close the other one.
Dog, cat, mouse.
Great, he can hear good in both ears. And then another test, I would go ahead and run through the Weber and the Rinne, which is testing for air conduction versus bone conduction on both sides of his ears. However, I do not have a tuning fork, so for the Weber test, I would activate the tuning fork, put it in the middle of his head, see if he's able to hear, let me know when he cannot hear it anymore. Then for the Rinne, I'd activate it, I'd put it in front of his ear, he would let me know when he could no longer hear it. I would then go ahead and put it on a bony aspect of his ear anywhere around here, and he would also let me know when he couldn't hear it. I'd do it on both sides, and I'd compare his air conduction versus bone conduction to find a normal finding. And now I'll go ahead and can you do 9 and 10? Can you say ah for me?
Ah.
Great. And now if you could, I'll go ahead and check your gag reflex. Go ahead and stick your tongue out. Great. He's got an intact gag reflex. And now I'll just have you, when I put my hand on your face, try to push against it. Great. Good. Raise your shoulders against mine. Push out your arms. All right, he has equal strength on all sides, which is normal. And then just once again, just have you stick your tongue out for me. Can you move it up and down? Take your tongue side to side. Great. Normal movements in his tongue in all directions. Those are all normal findings. So that was running through cranial nerves 1 through 12. And then I'll go ahead and check the motor strength of him. Go ahead and grab my fingers. Squeeze. Great. Pull me towards you. Push me away. Great. Stick your arms up like this. Push against me. Great. Good strength. Push outside. Good. And then if you can wiggle your toes. Good. Can you push against my hands? Push up. All right. Can you push your thighs against my hands? Great. And then last one, shins against me. Great. He's got good strength in all extremities, which is normal. And then we would go ahead and run through sensory. So I could run through with the tuning fork again to see if he could feel vibrations everywhere. But once again, I do not have a tuning fork, so we'll go ahead and just run with pain and touch. So once again, I'll let you feel it. That's soft. That is sharp. If you could close your eyes for me again. Let me know which you feel.
That's sharp. That's soft. Sharp. That's sharp. That's soft. That's sharp. That's soft. That's soft. That's sharp.
Okay, he's got good feeling in all of his extremities, and now you could go ahead and keep your eyes closed again. I'm going to touch one of your extremities, and you could just let me know which extremity I am touching and which side.
Left arm. Right leg. Right arm. Left leg.
Okay? Does it feel normal when I'm touching both sides?
Yes.
Does it feel the same when I'm touching both sides?
Yes.
Great. Sensation is intact in all extremities, which is also normal. So I'm going to run through some coordination tests for you. If you could take your finger, touch it to your nose, back down to your leg. Great. And now do the other side. Okay. And then I want you to take your hands, put them flat on your lap just like that. Flip them back and forth really quick. Great. And then last one, I want you to take this heel and put it on your shin and run it down your shin. Great. And then to the other side. Okay, good. He's got good coordination on both sides, which is a normal finding. I'm going to go ahead and run through reflexes here really quick. Good. Great. Okay. Okay, good. He's got good reflexes. And then last thing to do here, if you could just stand up for me. You could turn that way and take about 3 or 4 steps. Okay, come back to me. Good. I want you to walk on your tiptoes. Good. And then come back walking on your heels. And then last I want you to do, stand right in front of me. Close your eyes. I want you to just try to stay still. Okay, great. Go ahead and open your eyes and take a seat. Last test was just testing his Romberg to make sure that when he closed his eyes, he wasn't swaying or anything. He was standing perfectly still. He wasn't falling, wasn't getting dizzy or anything like that. So that was all normal. So we went ahead and ran through all the cranial nerves, motor, sensory, all that stuff. That's all just normal testing for a neuro exam, and his findings were all normal. Okay, thank you.